Most people over 60 believe a heart attack gives you a warning. Chest pain, panic, time to react. But that is not what I have watched happen again and again, because some of the deadliest heart attacks and strokes begin quietly at night, while a person is asleep after an evening that felt completely normal. No crash, no alarm, no second chance. After 60, the heart and blood vessels lose some of the protection they had in younger years, which means one common bedtime mistake can raise blood pressure, disturb oxygen flow, thicken the blood, and trigger a chain reaction while the whole house is silent. I have spoken to families who had no idea anything was wrong when they said goodnight a few hours earlier. That is why this matters. In the next few minutes, I am going to show you exactly what may be putting you at risk, why it happens, and what you can start doing tonight to protect your heart and your brain. Please do not ignore this. Here is the truth most people never hear clearly. Enough. Your heart does not go off duty when you go to bed. It changes assignment. In a healthy system, blood pressure usually falls by about 10 to 20% during sleep. The heart rate slows, the vessels loosen, and the body uses those hours for repair. That is the normal pattern. That is the protective pattern. But after 60, the system is less forgiving. Arteries are stiffer. Blood pressure control is less stable. Blood sugar swings hit harder. Oxygen dips do more damage. A small mistake in the evening can create a much bigger problem by 2 or 3 in the morning than it ever would have at 2 in the afternoon. In my years of working with cardiac patients, I have watched this same pattern repeat itself over and over. The final event looks sudden. The setup was not sudden at all. What time did you eat dinner last night? I ask that question because late heavy dinners are one of the most common triggers people never connect to their heart. They think about weight. They think about indigestion. They do not think about blood pressure, triglycerides, or the heart trying to do 2 opposite jobs at the same time. But that is exactly what happens when you eat a big meal late, especially one loaded with fried food, refined carbohydrates, dessert, or salty restaurant food. Digestion demands more blood flow. Insulin rises, triglycerides climb over the next few hours, and the body stays in a metabolic work state when it should be winding down. Your heart is trying to settle. Your digestive system is demanding a full shift. Those signals collide. After years of seeing what actually causes these events, I can tell you this is not a minor issue in older adults. A younger body often absorbs that stress better. An older cardiovascular system may not. Studies on meal timing have consistently linked late-night eating with worse blood pressure control, worse glucose handling, and more strain on the body's normal overnight rhythm. And here is what makes it more serious. A late heavy dinner does not just affect the heart. It can worsen reflux, fragment sleep, and push you into shallower breathing and more nighttime awakenings, which means the same habit may be hurting your heart and your brain at the same time by taking away deep restorative sleep. I have sat in recovery rooms and asked this exact question after frightening overnight events, and the answer is often painfully ordinary. Pasta at 8:30, takeout at 9. Ice cream at 9:45, bed at 10:15. Nothing dramatic, nothing that felt dangerous, but cardiovascular damage rarely announces itself while it is being set in motion. It whispers first. The practical fix is simple. Finish your main meal by 6:30 or 7 in the evening, and if you truly need something later, keep it small and light, something like yogurt, soup, eggs, or a little protein with vegetables. Then give your body at least 3 hours before sleep. Now stay with me on this one because most people have never heard this explained this way. Do you ever pour a drink at night because you think it helps you sleep? That habit fools a lot of people. A nightcap feels calming. It feels harmless. It feels almost old-fashioned. But alcohol before bed is one of the most misleading sleep habits I know. It may make you sleepy faster, but it often wrecks the second half of the night. Sleep gets lighter, awakenings increase, breathing becomes less stable. The throat muscles relax, snoring gets louder, sleep apnea gets worse, and when breathing gets worse, oxygen falls. When oxygen falls, the heart pays for it. Research has been pointing in the same direction for years. Alcohol can worsen snoring and obstructive sleep apnea because it relaxes the tissues in the airway and increases resistance in breathing passages. That means the person who thought he was helping himself sleep may actually be creating longer breathing pauses and deeper oxygen drops. And if you already have atrial fibrillation, or even a tendency toward it, that matters even more. We know from long-term heart research that even one drink a day has been linked with a higher risk of developing atrial fibrillation. In one study, a single drink doubled the odds of an AFib episode within the next 4 hours in people who already had it. That is not trivial. That is tonight-level risk. I have reviewed case after case where the contributing factor was something completely ordinary, and this is one of them. A quiet drink after dinner, a little whiskey before bed, sometimes an alcohol and sleep aid combination that leaves the airway even looser, and the brain even slower to respond when breathing becomes unstable. Then one problem starts feeding the next. Poor breathing raises blood pressure surges strain the arteries, irregular rhythm increases the chance of a clot, and that clot does not care whether it reaches the heart first or the brain first. The practical fix is this. If you drink at all, keep alcohol at least 3 to 4 hours away from bedtime. Skip the nightcap completely if you snore or have any heart rhythm history. And if you feel you need alcohol to fall asleep, bring that up with your own doctor instead of treating it like a harmless routine. Here is where it gets important. Has anyone ever told you that you snore hard, gasp, or stop breathing for a few seconds in your sleep? Please do not brush that off. I mean that sincerely. People laugh about snoring because it is familiar. Familiar does not mean safe. Obstructive sleep apnea is one of the most under-recognized cardiovascular threats in older adults, and I have watched far too many people discover it only after a stroke, a rhythm problem, or a frightening trip to the hospital. During an apnea episode, the airway narrows or closes, breathing drops or stops. Oxygen falls, the brain senses danger, and stress hormones surge. The heart rate jumps, blood pressure spikes. Then it happens again and again. Sometimes dozens of times an hour. This is not just about feeling tired the next day. This is repeated stress on the cardiovascular system while the person thinks he is resting. The American Heart Association has linked sleep apnea with higher rates of high blood pressure, coronary artery disease, stroke, and heart failure. An NIH-backed analysis of more than 4,500 middle-aged and older adults found that the burden of oxygen drops during sleep strongly predicted major cardiovascular events, with one cohort showing a 45% higher associated risk as that oxygen drop burden increased. That number should get your attention. The mechanism is not mysterious. Repeated oxygen deprivation and repeated surges in pressure injure the system over time. I have spoken to families who had no idea anything was wrong because the person never complained of chest pain. He just snored. He woke up to use the bathroom. He said he was tired. He blamed age. He blamed stress. He blamed poor sleep. But sleep apnea can create a chain reaction that reaches far beyond fatigue. It can worsen blood pressure control. It can trigger atrial fibrillation. And once atrial fibrillation enters the picture, stroke risk rises sharply because clots can form in the upper chamber of the heart and travel upward to the brain. That is how one nighttime breathing problem becomes both a heart problem and a brain problem. I want to be honest with you for a moment. I have sat across from people who came in for something routine and left with news that changed everything. And in case after case, the thing quietly causing damage was not rare, exotic, or impossible to notice. It was a habit, a pattern, a symptom in the evening that had been dismissed for years because it looked too ordinary to matter. I have watched this same pattern repeat itself over and over. That is why I am speaking to you this directly, not to scare you for no reason, to stop you from ignoring what your body may already be trying to tell you. The practical fix is to treat loud snoring, gasping, morning headaches, dry mouth, memory fog, or severe daytime sleepiness as medical clues, not personality traits. If any of that sounds familiar, ask for a sleep evaluation, and starting tonight, sleep on your side rather than flat on your back because that one position change may reduce airway collapse while you work on getting properly checked. This one surprises almost every person I share it with. How early do you stop drinking water because you do not want to get up at night? I understand why people do it. Nobody wants 3 bathroom trips at night. Nobody wants to risk a fall in the dark. So many adults over 60 start cutting fluids after dinner, and some stop almost completely by late afternoon. The intention makes sense. The effect can backfire. Even mild dehydration can thicken the blood, lower total circulating volume, and make the heart work harder to maintain steady flow. In a younger person with flexible arteries, the system may compensate. In an older person with narrowed vessels, plaque, or a history of high blood pressure, that extra thickness and slower flow may matter a great deal more. This is especially important overnight because circulation already slows when you are sleeping and lying still. For hours, blood is moving through vessels that may already be stiff or narrowed, and the body is not getting the support of muscle movement from walking around. That is one reason serious events often cluster in the early morning window. The conditions for clotting and pressure instability have had hours to build. I have reviewed case after case where the contributing factor was something completely ordinary, and going to bed to dry is on that list more often than most people would believe. There is another layer to this. Dehydration does not just affect the blood. It may also raise the chance of nighttime cramping, poor sleep continuity, and morning blood pressure. Instability. Then you wake up exhausted, stressed, and a little more inflamed than you needed to be. One problem starts nudging the next. The body is connected that way. Always has been. The practical fix is not to flood yourself with water at 10 at night. That is not necessary. The practical fix is to stay well hydrated through the day. Then have one normal glass of water in the evening, usually around 8 or 8:30, and keep a small glass by the bed so you do not start the night or the morning already behind. Now this next one is the one I want you to take most seriously. Do you ever miss your blood pressure medicine, take it at different times, or assume it is protecting you all night without ever asking whether that is actually true? This is where false reassurance becomes dangerous. Many people know their office blood pressure. Fewer know what it is doing at 2 in the morning, but nighttime pressure matters a lot. We know from cardiovascular research that blood pressure patterns during sleep can predict future trouble, and abnormal nighttime pressure has been linked with higher risk of heart disease, stroke, and heart failure even when daytime readings look acceptable. In one large study, when nighttime systolic pressure ran about 20 points higher than daytime pressure, cardiovascular risk rose significantly. Think about what that means. A person can feel fine, a clinic reading can look decent, and the real damage can still be happening in the dark. This is why inconsistency is such a problem. A pill taken late one day, missed the next day, doubled the next morning, then forgotten again by the weekend creates unstable protection. I have sat in recovery rooms and asked this exact question, and the answer is often some version of this. I meant to take it. I got busy. I thought one missed dose would not matter. But after 60, the margin for error gets smaller. A missed dose can leave the arteries exposed during the very hours when they are supposed to be resting. I want to be careful here because this matters. I am not telling you to change your medication timing on your own. Do not do that. What I am telling you is that you need clarity about whether your regimen is giving you solid 24-hour coverage, whether it should be taken at the same time every day, and whether your doctor wants it. In the morning, evening, or split, that conversation is not optional if you have hypertension, prior stroke, kidney disease, heart disease, or frequent morning headaches. Clinical data makes this very clear. Nighttime blood pressure is not background information. It is risk information, and here is what makes this even more serious. When blood pressure stays high overnight, it does not only strain the heart, it also stresses delicate brain vessels. That is why the same silent pattern that raises heart attack risk may also raise stroke risk. Different destination, same dangerous road. The practical fix is to build a non-negotiable evening pill check. Use a weekly organizer or alarm if you need one, and ask your doctor or pharmacist one direct question at your next visit. Is my current blood pressure plan designed to protect me through the night, and should I be monitoring for nocturnal hypertension? If you are hearing yourself in more than one of these habits, that does not mean you are doomed. It means you have a clear place to start that is very different. Fear without a plan helps no one. A plan changes things. I have watched this same pattern repeat itself over and over, but I have also watched people reduce their risk by changing what happens in the final 4 hours before sleep. That window matters more than most people realize. So let me give you a routine you can remember. I call it the quiet heart to night routine. By 6:30 in the evening, finish your main meal. Keep it moderate. Do not ask your heart to digest a banquet while it is trying to prepare for recovery. At 7, do your medication check, not a casual glance, a real check. If a blood pressure pill or any prescribed evening medicine belongs there, make sure it is taken exactly as your own clinician instructed. Between 8 and 8:30, have your last normal glass of water, not a giant bottle, just enough to. Avoid going into the night dehydrated. By 8:30, cut off alcohol for the rest of the night, and if you need something relaxing, make it decaf tea, light reading, soft music, or a short walk in the house. By 9, set the room up for sleep. Cooler is usually better than warm. Darker is better than bright. Quieter is better than noisy. By 9:30, if snoring or breathing pauses are part of your life, prepare to sleep on your side. By 10, be in bed, not in the kitchen, not on the couch with a heavy snack, not chasing one more show while your body misses its chance to settle. That is your action plan. Simple, memorable, real. If you start there tonight, you may help lower strain on your heart, support steadier blood pressure, improve breathing, and reduce the kind of silent overnight stress that has been taking too many people by surprise. And I want to ask you something personally. Which of these points surprised you the most? Tell me in the comments, because when people speak honestly about these habits, other families start recognizing the same warning signs in their own homes. And if someone you love is over 60, snores loudly, eats late, skips medication, or thinks a nightcap is helping, please share this with them. I am asking that because I have spoken to families who had no idea anything was wrong, and sometimes one conversation started in time can change everything. Everything shared here is general health information based on current research, not a substitute for your personal medical care. Before making any changes, especially to medications or sleep treatments, please speak with your own doctor. That is not a formality, that is genuine care for you.